Hi, I'm Tanya, an advanced practice nurse with 20 years of experience and the founder of Caregivers Coffee. If you or someone you care for has been diagnosed with AFib, or you're just trying to understand what it really means, this video is for you. Today, I'll break down atrial fibrillation, or AFib, in plain language, so you know why it matters, what it looks like, and what to do if it shows up. Let's get right into it because spotting AFib early is key. So, what is AFib really? Your heart isn't just a pump, it has its own built in electrical system that keeps everything beating in sync. Most of the time, that system sends a clear signal, tells the top chambers, your atria, to squeeze, followed by the bottom chambers, your ventricles. The result? A steady, coordinated thump thump you can feel in your pulse. But in AFib, that signal gets disrupted, like static on a radio. Sometimes it can be due to aging, high blood pressure, structural changes in your heart over time, even chronic stress. Instead of a smooth beat, the upper chambers, your atria, start to quiver, what we call fibrillate. That makes the heartbeat irregular and sometimes dangerously fast. When your heart's beating too fast, it doesn't have time to fill or pump effectively. That can lead to a drop in your blood pressure, reduced oxygen to your brain and body, and it can be an emergency. Why is AFib a big deal? Because when your heart is out of sync, blood doesn't move the way it should. It can pool, especially in a small pouch called the left atrial appendage. That's where clots can usually form. If that clot escapes and travels to the brain, it can cause a stroke. But here's what makes AFib tricky. Some people feel fluttering or a pounding, a racing, or a skipping in their chest. Some feel dizzy, weak, or just report feeling off, while some feel nothing at all. And that's why it's often called a silent threat. According to the American Heart Association, AFib increases your stroke risk 5 times, and it's even higher if it goes undiagnosed or untreated. So how does it show up? Because it can creep in slowly or it can appear suddenly. You might hear a provider say, there are no P waves on your EKG, which means the normal atrial signal isn't showing up properly. That's often the sign that something is off. Common risk factors include high blood pressure, heart disease, valve problems, sleep apnea, thyroid issues, long-term stress, just to name the most common. It's rarely just one thing. It's usually a combination that builds over time. So what should you do if you suspect AFib? AFib isn't always an emergency, but it can become one fast if the heart is beating too quickly or inefficiently. If someone you love suddenly feels lightheaded or dizzy, short of breath, like their heart is racing or skipping in their chest, they just look really off in a way that's hard to explain, don't wait. Get it checked. Most of the time, an EKG, which is just a picture of the electrical signal of your heart, is enough to confirm what's going on, and your provider will guide you through what all of this looks like. So, what do you need to know as a caregiver? If you're caring for a loved one, especially someone with a heart history, keep an eye out for sudden fatigue or breathlessness, feeling faint or unusually weak, a pulse that feels irregular or very fast, or even any stroke-like symptoms, and you should definitely call 911. There's an acronym called Be Fast, and this is a great way to remember the most common symptoms of a stroke, because in a situation like this, every second matters. B stands for balance, sudden trouble walking, dizziness, or loss of coordination. E stands for eyes, blurry vision, double vision, or sudden vision loss in one or both eyes. F stands for face, facial drooping or numbness. A stands for arms, sudden weakness or numbness in one arm or leg. S stands for speech, slurred speech, trouble speaking or understanding. And T stands for time. If you see any of these signs, even briefly, call 911 immediately. Even if it turns out not to be AFib, knowing the signs puts you one step ahead, and it helps you speak more clearly to your providers. So, in wrapping this up, AFib is more common than most people realize. You don't have to memorize every medical term, and I'll put that acronym in the description of the video. But understanding the basics gives you a voice, helps you build a foundation, and helps you advocate not just for yourself, but for your loved ones. If this helped clear things up, hit subscribe or share with someone who might be navigating AFib too. And remember, this video is for educational purposes only. It is not intended to provide medical advice, to diagnose, or to treat in any way. Always speak directly with your healthcare provider if you have questions or concerns about your health or the health of someone you care for.